8:15 now on this Thursday morning, September 24th. We like Thursdays because we get to talk to Dr. B, Dr. Brent Wallis, Chief Medical Officer of People's Health. Dr. B, I get text all the time and from people saying you either treated them or their parents and how nice of a doctor you are and how nice of a person you are. And I just got to pass that along, I guess, generically, because I don't know what HIPAA says and what I can say and can't. So the only thing I'll tell you is you have a lot of patients and families who think the world of you.
Oh, thank you, Tommy. That's very nice to hear.
According to the CDC, more than 1 in 4 adults over 65 fall each year, and of those people, less than half tell their doctor. Dr. Brent Wallis from People's Health joins us. He's going to explain why preventing falls is an important part of maintaining your health. Why is fall prevention such an important topic, Doc?
Yeah, fall prevention is very, very important, really because it's so common for our senior population. And, and the other thing is it can be prevented if you know what to do. So, even though you may not get hurt the first time you fall, you have to be very careful because one of those falls could result in a really serious injury. In fact, 1 out of 5 falls can result in a fracture, which is very serious with long-term complications.
And the chance for a complication, a serious injury, is because at 65 or around that age, your body just is not as tough as it used to be. I don't know how to explain it, how to phrase it exactly, but you understand what I'm getting at?
Yeah, it is. It is a little harder as you get older to heal as quickly as you do when you're younger. And, one of the other problems with a lot of our seniors is they have weaker bones. Seniors don't get enough vitamin D, which comes from the sunshine, and since they don't spend as much time outside, they can have a reduced amount of that vitamin, and that vitamin actually helps build stronger bones. So that's why fractures are more common.
Can that be made up out of a bottle or not necessarily?
Yeah, you definitely can. You can get it from supplements, from pills, but it's actually also really good to get from vegetables that you eat. So it's absorbed a little bit better with a lot of the foods that we eat.
So who is at risk for falling?
Yeah, I mean, any senior really is, and a lot of that is related to a decrease in lower body strength. The other thing a lot of our seniors have is foot pain or even neuropathy. Neuropathy is where you have numbness or tingling on the bottom of your feet. It's very common in diabetic patients. So if you can't feel your feet when you put them on the ground, you may stumble and actually fall down. The other group that I worry about a lot is any of our seniors who are using walkers or canes because maybe they have arthritis in their knees. So they're using that to help with their balance, but if they miss a step, then they can fall down. And then the other group that I'm always concerned about is people who are taking medications that can cause sedation or dizziness, especially certain blood pressure medicines. When you stand up rapidly, it can actually make you feel a little bit dizzy, and so you can fall down. The other big thing for seniors and their kids to watch for is any hazards in the home. So loose carpets or, cats and dogs running around, you can stumble over those and actually fall and possibly break a bone.
I hate to say this, doctor, because we both love our boxers, but, I'm coming off this knee replacement, and Betsy the boxer almost took me down yesterday, so it can happen to anybody. Hey, we're going to take a break. We'll come back and talk about if you think you're at risk, how do you talk to your doctor about it, and should you exercise, what part does that play, and some tips for preventing falls in your home. Dr. B's our guest, Dr. Brent Wallis, Chief Medical Officer of People's Health. We're talking about senior health as we do every Thursday morning at this time. It's 8:20. We pause for WWL traffic. Tucker, WWL, talking to Dr. B, Dr. Brent Wallis, our friend, Chief Medical Officer of People's Health, about senior health as we do every Thursday morning at this time, and we're talking about fall prevention. So, Doc, if you're at risk, for some of the people we've already talked about, should you talk to your doctor about it, and how do you go about it, and what kind of information is the doctor going to need?
Yeah, absolutely. You should talk to your physician about it. The annual wellness visit that all of our seniors should get actually includes a part where the doctor will ask you about some of your fall risk. They'll ask you about what we talked about with pets in the home, carpets, and then also assess your lower extremity strength. They can also give you some exercises that can help a little bit, to help improve your balance. I think the other key thing that I mentioned before was doing a complete medication review. A lot of prescription medicines can cause dizziness or unsteadiness, but so can some of the over-the-counter medicines that we don't think about. Even cold medicine, something as simple as Benadryl, can actually make you feel sleepy and can increase your risk for a fall. And then we mentioned, too, the vitamin D supplements. So usually your physician will check your vitamin D levels at some point and determine if maybe you would benefit from some supplementation.
And you talk about exercise. We're not talking about exercise necessarily to get you ready for the Senior Olympics. You're just talking about strong enough to keep everything working, right?
Yeah, it's really exercises that improve your core strength. So balance is really driven from the core. And so sitting to standing is very important to make sure that, when you're a senior, you can't always jump out of the chair and go run across the room. You have to take it a little bit more slowly. So increasing the strength that you use in order to get to an upright position is very important.
What about some tips to kind of lessen the chance of somebody falling in their home?
Yeah, I think one of the biggest things, like I mentioned, is keeping your floors and your rooms clutter-free. Being careful about pets. They definitely can get under your feet and cause problems. The other thing to think about is a lot of our seniors wear glasses, but they don't always wear them around the house. And so if you're in a dimly lit room and you're not wearing your glasses, you may not see something coming up on you. And if you trip over it, then that could result in a fall as well. Another thing you have to be real careful about is step stools. A lot of our seniors, want to be very independent, which is very good, but you should be very careful about getting up on a stool or a ladder to get something out of a cabinet that's real high. Either ask for help. There are hand grabbers that you can actually buy that can help with that as well. And then in the bathroom, which is really where we see a lot of falls occur, typically bathrooms have slick surfaces in the showers or even on the floor. So using skid-proof rubber mats can help, and you can also install grab bars. So if you feel unsteady or think you may fall while you're in the bathtub, you've got something to grab onto.
I'm so glad you're talking about this, because after somebody falls, then you got a whole bunch of problems that you're looking at that could have been avoided just by, I guess, some pre-planning, right, Doc? Even clothing, that can factor into this?
Yeah, even clothing, in particular, shoes are very important for a lot of reasons. Some seniors don't wear shoes around the house, which can be dangerous because if you step on something, you could puncture your foot that can result in infection. But the other problem is wearing slippery socks or flip-flops. Those you can trip over pretty easily. So wearing supportive rubber-soled shoes is really important to do. Another thing to think about for fall prevention or what happens if you do fall is keep your cell phone on you because if you do fall down and no one's in the house to help you, you want to be able to contact someone immediately. And, some people use emergency alert systems, but one thing that's just as good sometimes is making sure you've got your cell phone in your pocket.
And with as many things that we've talked about, there are even more elements, I guess, right? That can be a factor?
Oh, yeah, definitely. There's a lot of things that can also make you feel dizzy. Temperature is one in particular. In Louisiana, we have to be real careful about. We sometimes see more falls in the summertime, especially people who don't have air conditioning. When you get too hot, your blood pressure can go up. That can actually make you feel dizzy. Alcohol consumption is another big one. So, while it's okay to have a little bit of alcohol, having a little bit too much can make you very unsteady on your feet. And so that's more likely to cause a fall. And then, like I mentioned before, being a little bit slower and a little bit more intentional when you're moving from either a reclined or a sitting position to upright, because our seniors, especially those on those blood pressure medicines, can sometimes have a little bit of dizziness when they get up too fast.
And if you do fall, what do you do? What happens?
Yeah, if you do fall, I mean, there's a couple of things. I mentioned the cell phone, which is very important so that you can get help immediately. The other thing, though, is after a fall, a lot of seniors are very worried that they may fall again, and that can actually result in them, not actually trying to get up and moving around, which can lead to weakness and additional problems. So if you do fall, don't be too scared to move around. Just make sure that you situate your house and you've got the support you need and continue working on those exercises.
A couple of seconds, Doc. Can you tell us about the virtual presentation?
Yeah, we've got a great presentation coming up on fall prevention. It's next Wednesday at 10 o'clock in the morning, and you can actually sign up for it online at peopleshealth.com wellness, and it's a virtual event.
And it's entitled How to Prevent Falls, and, man, it is so much easier to prevent it because we all know what happens after the fall does occur. Thank you, Doctor. I appreciate it as always. Have a good weekend, all right?
Thanks, Tommy. You too.
All right, y'all can also go to peopleshealth.com. You can call 855-821-2666, or you can follow People's Health on Facebook, Twitter, and Instagram. 8:30 time.